Hi, everyone. I'm Jay West, and this show is called Directions. Directions is about people who have gone through transitions or are going through transitions or help other people in transitions in life. And so today, my special guest is Dr. Bruce Godfrey, my chiropractor.
Good morning.
Good morning. Nice to have you. We were just talking about who recommended me to you, and we can't remember. So that's okay. But I've enjoyed coming to you since I started, and you've been a big help. And you also helped my wife some. But I want to learn about you before we talk about chiropractic care.
Okay.
I want to learn, like, what prompted you to go into chiropractic care? Did you have a family member? Did you just suddenly get interested in backs and shoulders and necks, or how did that happen?
Growing up in the 1970s, my parents were kind of to the hippie side of things. So our lifestyle at home was there was no sugar in the house. They tried to keep things very natural, homemade food and no processed food. And that extended into their healthcare choices as well. So my parents were chiropractic patients in St. Louis, and I was a chiropractic patient as well when I was a young kid. I don't remember it very much, but when I was in junior high and high school, and also early college, I was involved as a passenger in a series of car accidents. So I was never the driver of the car, but I was a passenger in 7 car accidents over the course of
when you
about
say that,
7
a
years.
series of accidents, it makes it sound like you were in this car and then you got hit and you propelled into the next car, got hit and you propelled in. No, I'm teasing. You've been 7 car
I was in
accidents?
7 car accidents in middle school, high school, and college as a passenger.
Wow.
So, for instance, my dad took a turn too fast. I was the passenger, and he ended up hitting someone. I was going home from college in a friend's car, and traffic came to a sudden stop, and she stopped, and then the car behind us rear-ended us, and then 2 more cars rear-ended the stack. And I ended up seeing chiropractors to recover from those accidents.
Okay.
So that got me interested in the profession.
Because I've been in 2 car accidents, one with a semi-truck and one just with and both times I was T-boned, so I just, 2 seems like a lot to me. 7 seems like, but as an adult.
I haven't been in any car accidents.
Was that your little car out there? I saw the little blue car out there.
That's not no, that's the little smart car. That's not mine.
That's not yours. It was a Fiat, but anyway, I thought maybe it was yours. I hadn't seen that car here before, so I thought maybe it was yours. So
no. So I haven't been in a car accident for a long time, but I wanted to be a doctor. My mom told me that in 7th grade I came home and announced I was going to be a doctor. And having gone to chiropractors from these accidents, I realized that there was more than one way to be a healer.
Sure.
And looking into chiropractic, I learned that you help people not with medications and surgery and those sort of things, but just with your hands.
Sure.
And that appealed to me greatly.
Interesting. I was thinking on the way in, because I asked my dentist this one day, and I don't think he gave me a great answer. He gave me an okay answer at the time, because I asked him, what prompts a person to focus on a very small area? The dentist looks, you got 32 teeth, or after wisdom teeth, I guess you got 32 teeth. And it's like, what? And it's the same stuff over and over and over. I mean, the teeth, they're different mouths, but it really doesn't change a whole lot. Mm-hmm. You know what I'm saying?
It's only so many things.
Yeah. And like you are focused mostly on backs and necks, maybe other limbs too. Mm-hmm. But to me, you have to have a special calling just to stay focused in one area. Like my job, I get to interview people on TV. I write books. I travel over the nation. I speak on a wide range of subjects. I pray with political leaders. I feel like I have a lot of different things going on. And you have like a focused area, one focused area. How does what drives you to stay focused on one area?
So the chiropractic can seem very simple. We're just pushing on your spine and trying to move the bones in the spine. But dentistry and chiropractic have this in common, which is a limited intervention, a focused intervention has broad effects on the body.
Right.
If you lose your teeth, it doesn't just affect your teeth, it affects your whole health picture.
Right.
And it's the same with the spine. If the spine is malfunctioning, it doesn't just cause a spine problem, it doesn't just cause pain, it actually affects your whole central nervous system. And if you're affecting the whole central nervous system, it's a window into your overall health. So it's a focused intervention, but it has broad effects.
So besides the chiropractic at your office, and I have not explored this or asked you because I told you I don't pre-script the questions. So what other medical services do you provide there? Is it, I know there's some, it seems like you have, I know you have massage, that's somebody else that does it. I know that it seems like there's some dietary things that are done there too. I think I've seen that. Is that accurate?
Yes. So I primarily focus on rendering chiropractic adjustments. I also have some physiotherapy modalities that I can use to support what chiropractic care does. For instance, we have electrical muscle stimulation, which is also called interferential current therapy. We can apply that to help reduce inflammation, reduce muscle spasm, help people be more comfortable. I do have a massage therapist who works in the office. I have a couple other massage therapists who basically rent space from us. And the weight loss lady also rents a room from me. Her name's Brenda DeVries, and she runs a company called La Vie Weight Loss.
Okay.
So she does a whole dietary program with people, but that's separate from what I do. That's her business, just run out of my space.
Tell me a couple of stories about really difficult cases or severe cases that you helped and they're just substantially better. You got a couple of stories?
So back to your previous question, what keeps me interested and what keeps me passionate is that every day is different. And I never know who I'm going to see or what kind of situations I'm going to run into when I show up in the morning. So that makes things interesting and not boring. It keeps me tries to keep me on top of my game. So just this week, I sat down with a gentleman who's 50 years old, 51 years old, but he has not been able to work since December of last year because of lower back pain. He used to work at a local meatpacking plant, and his job was to take the insides of the cow out of the cow, which is about a 120-pound load. And he'd have to move that load over and over and over and over and over and over during the day. And over time, developed this severe lower back pain. But now he hasn't been working for 8 months, and he still has chronic, every single day, debilitating lower back pain. So I saw him, today's Friday, I saw him on Monday and was able to do a limited amount of work on him just because he was in so much pain. He couldn't move around very well and get up and down off the table. I couldn't touch him very firmly because it was too painful. So I had to use a very gentle technique. I had to work around what he could and couldn't do. And we were able to get him just with one adjustment to the point where he could stand up straight, move around, get up and down off the table. He was able to sleep for the first time a full night. So a case like that where you have just chronic, unrelenting pain can sometimes respond very well even to just one chiropractic visit.
Had he been to other doctors or
He had
chiropractors,
spinal
medical
injections.
doctors? Or
Yeah, he had injections. He went to the spine specialist, MRIs, x-rays, medications, and nothing had resolved his issue.
Yeah,
So
when I first
I
came
was
to you,
able to help
I
him.
was having some pain, and you suggested, and I did an MRI. I don't know if you remember that or not.
Sure.
And the MRI didn't really produced a little bit of information, but not very much. So in my case, that didn't help. I know way before I met you, I had neck and shoulder pain for 26 years, and I went to a variety of medical doctors, chiropractors, different places that we lived, and it took an act of God actually for it to disappear. But all that working also to that point, it was like little by little. The Bible talks about little by little, precept upon precept. It was all helpful, and
Well, the important thing is you didn't give up.
right.
You kept looking, you kept
Yeah.
searching for answers.
But I got well in 2011, and basically what I used to have, I haven't had in 14 years now. Tell what over the time, I hadn't planned to even think about this question, but I know there was a season, and maybe a longer season than I'm aware of, where medical doctors didn't really embrace you very well, embrace chiropractors.
Yes.
What was that like? How was that, and how were those transition days or different?
So going back to your original question of what got me into
You
chiropractic.
like my original question.
is-
Should never ask that
is-
question.
Well, so it feeds into this though. In my family, going to the chiropractor was normal, and it was no big deal. If you had a problem,
Right.
you know, with your neck or back or headaches, car accidents, you went to the chiropractor.
Right.
And I grew up with the idea that going to a chiropractor was normal. And I didn't learn that it was not normal until I was in school. And part of the chiropractic education is you enter the student clinic and you have to go out into the public and bring in new patients.
Really?
So once I encountered the larger public out there, I realized that the attitudes about chiropractic in the public were actually quite negative. And there's a larger story between the chiropractic profession and the medical profession that dates all the way back to the early 1900s. Chiropractic was established as a profession, and the first chiropractic school was established in the late 1800s, around 1895 to 1900. At that time, that was before x-rays were discovered or understood. That was before antibiotics were understood. There were very limited things that medical doctors could do. And there were other professions out there like naturopathy and osteopathy, bone setting, chiropractic, magnetic healing. Kellogg's big sanitarium was running up in Battle Creek, Michigan. Those all sorts of things happening in healthcare
What
at
was
the
that?
time.
Eat more cornflakes, you get well?
It was all about fiber and taking
Yeah.
the cure. So there's all this stuff going on in healthcare. And the allopathic profession, medicine, became dominant through whatever means they became dominant, and was actively either trying to absorb or suppress every other healing profession, and that included chiropractic. So now an osteopath is essentially a medical doctor, and they've been absorbed into that profession. Naturopathy was almost eliminated. Chiropractic somehow managed to stay independent from the whole medical field and endured people being arrested and jailed for practicing medicine without a license. Medical doctors were forbidden by the AMA to refer to chiropractors. So in the late 80s, a lawsuit ended up in the Supreme Court in the antitrust space, and a number of different medical organizations, including the AMA, the American College of Surgeons, and some others that I don't remember off the top of my head, were found guilty of antitrust violations against the chiropractic profession and were ordered to knock it off.
So was it
So
around
this is
that
like
time
right before I went to chiropractic school.
was it around that time that insurance started changing and covering things like that? Or
Medicare has only covered chiropractic since 1986, I think. And after Medicare started covering chiropractic, other health insurance companies started covering chiropractic. But there was this animosity between the medical profession and the chiropractic profession all through the 1900s into early 2000s. So I graduated from chiropractic school in 1997, and I purchased an existing practice, but I had to go out into the public and meet and greet people, shake people's hands, look them in the eye, tell them about chiropractic, and try to basically recruit business for my office. And 27 years ago, I got a lot of negative responses from that. People would dismiss me, call me.
You're here in Omaha. Were you raised here in Omaha?
We moved here in 1986 when I was a freshman in high school. Yeah.
Okay, what, after the 6th accident? No, I'm teasing.
Yeah.
So-
A couple of the accidents occurred in Omaha. So
now I know that you shared this once, that you were helping a previous chiropractor that I went to, Dr. Brockman. How long did you work with him, and how did that trend? When you graduate, do they put you with another chiropractor? Is that what they do, or do you just have to do that so you get some patients, or how does that work?
one of the big differences between graduating with a doctor of chiropractic and graduating with a doctor of medicine is that the medical graduates have a whole system that they graduate into to go down the path of specializing in some field.
Sure.
So you do internship and residencies and fellowships.
Right.
And that's all supported by the whole healthcare system.
Right.
When you graduate from chiropractic school, you are on your own. So I ended up doing an internship that I set up myself with a doctor here in Omaha, and ended up getting a job in his office as a new doctor. And just by chance, 6 months later, he decided he wanted to move to Colorado. So he offered me the opportunity to buy his practice. So I got a loan from the SBA, purchased his practice, and that got me started. Dr. Brockman was renting a room out of that office. So I inherited Dr. Brockman as a tenant.
Oh, he was your tenant.
In my office, correct.
Interesting.
And he stayed for about 6 or 7 years, and then decided he wanted to open his own office and moved into his own space. So that's how I knew Dr.
So
Brockman.
you have all these transitions, which fits well the theme of our show. How did you First of all, how long is the chiropractic school?
So I have a bachelor's degree in biology,
Okay.
which is 4 years.
Okay.
And I have a doctor of chiropractic degree, it's a 10 trimester program. So you go year-round school for about 3.5 years.
Okay.
And then you graduate with that doctor of chiropractic.
It's just new information. It's just interesting that part of the coursework was you had to go out and recruit people.
Yes.
That's just
The student clinic.
That's just very strange to me. But because I live in the world that you're right there, and there's chiropractors everywhere now with offices everywhere. And
Sure.
when I lived in Bellevue, I went to the chiropractor there, and now I live where I live, so I come to you. But I can't imagine my dentist starting out and say, "Well, I'm going to go find people that have tooth decay," or
Well, I think
people that have
close to
breathing
100% of people go to dentists.
huh?
Close to 100% of people go to the dentist.
Yeah,
Maybe not 100%, the majority.
right.
But only about 10 to 15% of people see chiropractors. So our market share is still pretty small. I think maybe in Omaha and in Nebraska, it's a little better. And we could get into the reasons for that. But I think the perception of chiropractic in Nebraska is better or more positive than anywhere else in this country, and certainly around the world. There are not very many chiropractors outside of the United States.
I know my personal medical doctor, who's a personal friend of mine as well, has on different times when I've been dealing with different things in my life, he said, "Well, have you gone to a chiropractor? Mm-hmm. Would you consider going to a chiropractor?" He's one that would recommend, but others I know have not in the past. So
that has changed drastically since I started in practice. When I started getting even to have a conversation with a medical doctor as a chiropractor, it was nearly impossible.
Well, I found it
And
interesting.
people would try to keep it a secret that they were coming to see me.
When you suggested I go have an MRI and then you said you could get the results, that startled me a little bit. I didn't think you could get the results even. When
Sure.
you shared that,
Yeah, something people might not know is that as a chiropractor, I can order advanced imaging, MRIs and bone scans and CT scans, nerve scans. I can order that under most insurance policies.
Have you ever done or been involved in acupuncture?
I am certified in acupuncture, and I do a limited amount of acupuncture. But the way that my practice flows and my business is set up, it's not really conducive to the whole acupuncture experience where you have a room to yourself and you put in the needles and then you just be there for half an hour. That's sort of when I go to the licensed acupuncture, that's what I experience. Just the way my office is set up, I don't have the space to do that. But I do use some acupuncture in my office.
One of the things I find unique about your service is that you allow patients just to walk in, which is really great for me because I travel so much. Mm-hmm. And every week is different. Like last week I was gone. I left Friday and came back Tuesday. The week before I left on Wednesday and came back on Saturday, and so my schedule is constantly changing. I did call and make an appointment for a massage after I got back, but just because of some lower back pain that I was having. How'd you come up with that idea of just letting people walk in? And is it successful for you or not? Is it hard on you?
So the last question, is it successful for me? Yes. It's been a good business decision for me. But if you go to 10 different chiropractic offices, you're going to have 10 different experiences just as far as how they run things from a business perspective. Because there are two parts to being a chiropractor. One is the chiropractic part, where you're helping people and rendering health care, but then you're also, something like 90% of us own a business. So you're a business owner, and you have to decide as a business owner what structure you're going to use. So some chiropractors want to see one person every 15 minutes, and they do an extensive number of techniques on them. Some people bill insurance, some people are only cash-based, some people want you to purchase an entire treatment plan up front, which is a certain number of visits, and some people do like I do, where we're just gonna think a couple of weeks ahead or 3 or 4 weeks ahead, and you pay per service, per visit. I don't try to sign people up on contracts or long-term care plans. And because I have that business structure, an individual visit doesn't take very long, and therefore I can allow people to have walk-ins because you're not going to wait very long for me to be able to get to you. And I got to that point just through trial and error. I tried different business models, and
it appears, from my standpoint, that you're very flexible.
Yeah, I've tried to become that way.
And doctors who are not flexible, I've observed some that are very strict, regimented, almost controlled. I find it difficult because even when you set up an appointment, I mean, I've done lots of walk-ins with you, and I've done set-up appointments, but either case, I've waited very little time. But others that have had very controlled environments, I've waited a long time, And I thought, why am I waiting so long if the appointments are controlled like every 15 minutes or whatever? So, good job.
It's just been through trial and error, and I've been to the same kind of thing where you end up waiting for half an hour past your appointment time,
right?
And you wonder what's going on.
Right.
I think it's easy to get caught up in a conversation or go down a path you hadn't intended to go on, and then end up with a longer appointment than you initially thought. And then the next person has to wait, and you're already behind.
For me, like when I go to my medical doctor, if I have a physical or whatever I need to go, I try to schedule to be the first appointment for him after lunch.
Sure.
That way I know I'm not going to wait very long.
You're going to get in.
Because exactly. I asked him, what's his normal lunch break? Now, I know that could change too, because he could run long, but still, but if I make it late in the afternoon or late in the morning, I know I'm going to have to wait a long time. So
sure. And the model that I have isn't perfect, because there are times when unexpectedly a bunch of people come in as walk-ins all at the same time, and then I'm behind and someone ends up waiting. But usually we can get through things efficiently enough that nobody walks out angry.
What brings you a lot of joy, and what brings you a lot of heartache?
You mean in practice, or?
Yeah.
Okay.
Yeah.
So what brings me a lot of joy is when I start seeing a patient and then they bring in a family member or their child or their husband, and they've had a good enough experience with me that they trust my services with someone else. Because they're not just putting my reputation on the line, they're putting their own reputation on the line.
Right.
And I have to honor that trust. So that brings me a lot of joy. What brings me heartache is when people give up too soon. Chiropractic care is not a quick fix. Unlike the story I told you earlier with the guy who was better in one visit. Well, even he's not completely better. He's going to have to go through a treatment plan in order to fully recover. But it's a process. So anything, when you try to change the body, like weight loss or personal fitness or healing an old wound, it takes time and it takes repetition, it takes persistence.
I'm on a weight loss thing right now, and I've lost 27 pounds, but it's taken me 3 months or a little bit longer to get to this point. And I didn't put that 27 pounds on just like that, so it's not going to come off just like that either.
Yeah.
So.
And back and neck pain doesn't happen in an instant,
and
unless you fall down the stairs or something.
We know lots of healing is a process. So whether you're recovering from a surgery or just have a cast on a broken bone or whatever, lots of healing is a process. So,
but I've also come to learn that people don't take chiropractic on as a lifestyle the first time they encounter chiropractic. It takes several encounters, and sometimes with different chiropractors, for people to realize that they need to maintain their spine just like they maintain their teeth. So chiropractic should be a periodic thing that they get in order to keep a healthy
It'd almost
spine.
be nice because the dentist, used to be 6 months. Now they're saying 3 to 4 months to clean your teeth, which I don't yield to. I can still go with 6 month or 7 month thing. But yeah, so we have like 2 minutes left. Why don't you share with the audience, or with me, where your practice is? Do you have a website? How they can get a hold of you? What days you work, etc.
Sure. My office is located in Exarban Village at 67th and Center Street. I've been there since 2011. My website is godfreychiro.net, godfreychiro.net.
They'll run that on the bottom of the screen for us. So
My office phone number is 402-331-0392. I'm in the office Monday through Thursday between 8 and 6. I do take a break in the middle. What else did you want? So you can reach me either by phone or through the website. We have a button you can click to request an appointment. I'm on Facebook and Instagram.
When I had a chiropractor that I liked in Bellevue, and when I moved and got remarried after my previous wife passed away and so on, I was really restless because I was driving all the way from Elkhorn to Bellevue, and it's 45 minutes, and actually 50 minutes to the office and 50 minutes back. I said, this has got to stop. I got to find somebody. So I was very grateful to have found you. You're still 20 minutes away. But
when I moved from my previous office at 96th and Q Street to 67th and Center Street, most of the people west of 120th stopped coming.
Yeah.
So it's a very local thing.
Anyway, thanks for tuning in today. Thanks for listening to my story with Dr. Godfrey. I recommend him, and I've been wanting to have him on for a long time, and it just worked. Normally we don't record on Fridays, but he's off on Fridays, and we're recording. So thanks for tuning in. God bless you. We'll see you next time on Directions. Bye-bye.